I'm not seeing the health indicators from the document that would suggest that people's health would be any better. It would seem to me that the driver, which they're now coming out and saying, is the PFI initiative at Calderdale Hospital. Now, the health needs of Huddersfield people should not be dismissed in return for meeting financial outlays. So it's not quite as simple as health needs versus the other health needs. It's not about, it should be where we cite the A&E that best meets the needs of the population that it serves. A&E at Huddersfield, when I was a staff nurse in casualty in the late 70s, we were always on take for the motorway. That has not changed. They were geared up, there is facilities for the air ambulance to land, but there are not equivalent facilities in Calderdale. So I would like to know really what it is about the information systems and the data that they are using that actually justifies a switch from downgrading. I'm not saying they should downgrade Halifax A&E, I am not saying that, but what I want to know is what is the information that they are basing that document on. And I've actually looked at the document and it's based on the response of 2,500 people, which is less than 2% of the population of Greater Huddersfield and Calderdale.
For the last nearly 3 years I've been in town on Saturdays with this petition, which is from Huddersfield Keep Our NHS Public. We knew that there was going to be a closure of at least one A&E and possibly two, and we are concerned that the real driver in all these cuts is private healthcare companies from largely from America with saturated markets, and they're looking for where they're going to get their next payments, and people will pay anything for health. And as we've seen with dentistry, it was taken off us and people now regularly pay for dental treatment, and that will happen with health as well. We'll end up with 20% of the population who simply can't afford to be healthy like they do in America. Even though they spend nearly twice as much per capita on health, they don't have the same level of health as we have. So it's an absolute madness for us to vote for anybody who would privatise our NHS.
Absolutely furious about what's happening. Absolutely steaming. I just think that taking the A&E away from Huddersfield is going to kill people. I myself have got a slight heart problem, and if I have a heart attack or a stroke, which is a remote possibility, by the time they get me to Halifax, I'll be dead. And that's going to apply to so many people. It's essential. Keep it in Huddersfield.
For me, and I've already written my concerns to the CCG and expressed my concern that I am so dismayed, is that they want it to sell a particular picture that if we do this, the money that goes from Huddersfield can bail out Calderdale PFI. Not Calderdale A&E, but Calderdale PFI, which is totally different. The CCG or PCT, as I remember them being, are responsible for the health needs and services that are sensitive to the needs of the population that they are put in place to serve.
Well, more people will die because, as we know, seconds count when there's been an accident, or if you've had a heart attack or a stroke, seconds count, and the longer it is that it takes to get you to hospital, the more people will die. But the other thing is, if you lose your A&E, you lose a lot of expertise in high dependency and intensive care nursing. You know, we'll become a sort of cottage hospital in a town of 100,000 people. It's ridiculous. I think the CCG does need to put pressure. The main problem is that central government will not fund public services adequately. They don't believe in public services. They are all themselves beneficiaries of private companies that make money out of these things. Alan Milburn, who was the health secretary under Tony Blair, sits on a hedge fund benefiting from PFI, which he instituted. You know, I think it should be treasonable, that.
Absolutely. It stems directly from the Tory government's policies. They're just trying to undermine the whole of the welfare state successfully, and the more they can make things look bad, then the more excuse they've got to sell it off to their mates to make lots and lots of money out of us. It's appalling.
The consequences of this are not unintended, they are intentional. And to intend to close A&E, knock the hospital down, in their words, and build another one, well, they might as well reopen the Princess Royal, which is a former maternity hospital, and say, actually, we don't need inpatient beds in Huddersfield. And I don't think it will happen. I would absolutely want concrete reassurances that what they say is going to happen will happen, and I don't actually think that will be the case, as is evident in other parts of the country. And actually, if we take Dewsbury, our neighbouring part of North Kirklees, the things that were said to them, I understand, that have not been carried out. So I actually don't trust them, and trust is paramount to that relationship and the CCG, and if we can't trust them on the big issues, then how can we trust them to look after the small things?
I'm aware, well, for a long time, that the NHS has been under attack by special interests, private companies, Parliament, governments using that old chestnut of there's not enough money, there's not enough money, there's not enough money. So what they're doing is using that as a way to lull people into believing there's not enough money, so they're going to have to privatise it, put it into private hands, which will obviously have catastrophic effects, because the NHS, it's a service for the public and people pay into it, and once it goes into private hands, which it is at the moment, to be honest with you, it's actually gone into private hands already. There's a lot of different hospitals all across the country and different divisions and sectors that are being privatised. And what it is the problem that we're having is the Parliament and government are not being transparent and honest about the real reasons why they're doing it. So they're happy to take our money, do whatever they want with it, and then come to us and tell us that they haven't got enough money. But they've got enough money though, haven't they, to go and invade other countries, haven't they? They've got plenty of money for that. It's like a limitless pot.
It appears to me that the council and the MPs have actually sleptwalked into this position. I'm not saying that they're not taking action now. Calderdale have campaigned long and hard to retain their A&E services, but there's been nothing apparently from their equivalent people in Kirklees, in Huddersfield.